I'm Dr. Tracy Stecker, and welcome to the Choosing Help podcast. Choosing Help presents conversations about courage, connection, and the transformative power of asking for support. Through candid discussions, expert insights, and real-world stories, this podcast breaks down stigma and opens doors to understanding. Join our community committed to compassion and courage, because when we choose help, we choose life. This is Dr. Tracy Stecker, and I'm joined today by Dr. Amanda Rains. Dr. Rains is a clinical psychologist and a researcher and an expert on all things related to anxiety and anxiety disorders. Today, we're going to be talking about safety aids. I am super excited to be talking about this topic today. It isn't one that gets a lot of attention, but it really deserves to because the impact on people's lives is actually pretty extreme and dramatic. And I think it calls for some attention to it. So Dr. Rains might do a better job of explaining what a aid is, but I'm going to give it an attempt and then she can fix whatever I say. But a safety aid is essentially any behavior you do to reduce anxiety. So we all engage in certain things to reduce our anxiety. We all have situations that make us feel anxious. For some of us, we engage in behaviors that reduce our anxiety, but they also serve to increase our anxiety over the long haul. And so it's kind of ironic. So one example is drinking. You might feel anxious in a certain setting, so you take a drink. The drink, in your head, you believe it reduces your anxiety, but in reality, it increases your anxiety. It increases the fear response. And unfortunately, it increases your reliance on alcohol. So I was thinking for a little kid, I talked to one of your colleagues the other day, and he used an example of Linus's blanket. So
Mhm.
that's another example of a safety aid. A child may be relying on a blanket or a pacifier or a stuffed animal. Their reliance on that, they believe it helps them deal with anxiety or manage discomfort, but in the long run, it's actually increasing their anxiety. The trick here is to learn how to manage your anxiety without the reliance on these other behaviors, or at least be aware of them when you're doing them, right? Okay,
Yeah.
so let's get into it. I'll let you fix anything I just said that
No,
was a little off.
that
Um,
was a great definition. But yeah, safety aids are essentially any sort of cognitive or behavioral technique that we may use in the short term to sort of avoid anxiety or circumvent anxiety. And oftentimes in the short term, they do make us feel better. Like you
yeah.
mentioned with the alcohol or the child who has that stuffy or blanket that just makes them feel safe. But in the long term, they're actually not serving any sort of true safety purpose or function. And so they're actually, unfortunately, causing us to not only be dependent upon that thing, but also increasing our anxiety over time because we're never truly learning that we can tolerate our anxiety, that this thing isn't actually preventing the feared outcome from occurring. And so, yeah, so they're oftentimes a really hard habit to break because
Mhm.
they do make us feel better in the short term. So,
Exactly.
yeah.
Yeah.
But the wild thing is that we also do a lot of mental ones too, which is interesting. And
Give us
those are
some
just,
examples.
yeah. So some of the more common mental ones are things like just, distracting from certain thoughts. So we see this one a lot with folks who might have OCD, obsessive compulsive disorder, or either PTSD, where there can really be those sort of intrusive, unwanted thoughts that might pop into your head sort of unexpectedly or even sometimes triggered by something in the environment. And so we might attempt to, sort of distract from those by either thinking of something positive or, going to a certain, place in our minds, or even doing something behavioral to distract from them, turning up the radio or changing the TV channel. And once again, sort of that avoidance of our own thoughts sends the signal to our brain and body that even our thoughts are dangerous when they're not always inherently dangerous. They're just thoughts.
Hmm.
But yeah, oftentimes we think a lot more like you were saying about the behavioral ones. And I love that you gave the example of alcohol because when I'm first explaining safety aids to a patient, I always use that as like the example because it's such a easy example for people to understand.
Hmm.
And then it also is easy for them to understand how the safety aid in turn could become a problematic behavior. Because I
Yeah.
think sometimes we don't think of these things as being something that's necessarily, bad for us in the
Bad.
long run. But
Yeah.
something like a substance or alcohol, you can easily see how, wow, yeah, I could become dependent upon that. And then I have a whole other problem.
Yeah. I was
So,
thinking of even like, I know certain people don't like to go to the dentist. They have a fear of the dentist. Oh, really?
my whole
Okay.
life.
Okay, well then let's get to it. So a fear of the dentist, and then they avoid going to the dentist. They don't go for the regular cleanings. That avoidance is a behavior that's a safety aid, correct?
Correct.
So they're engaging in a behavior to reduce their anxiety, but what it inadvertently is doing is increasing their anxiety about going to the dentist. So if
Yes.
you never work through that fear, you don't go to the dentist and have a good experience. I love the little cinnamon stuff they use to clean your teeth. That stuff makes me so happy. I have a very positive association with
That's
that
so good.
cinnamon stuff and getting my teeth clean. But if you never, you really do, you use avoidance
Yeah,
as your way of managing your discomfort about that, or your fear even about the dentist, then your fear about the dentist just grows and grows and grows, and you never get that opportunity to
absolutely.
realize there may not be anything to be uncomfortable about.
No. No, that's exactly right. I have a recent example too. So before we hopped on, Tracy was congratulating me because I'm about 8.5 months pregnant, and one of the things that's been really interesting is I've also always had a slight needle phobia sort of fear. So I avoid at all costs like having to get a vaccination or a shot if I can, despite firmly believing in vaccines and knowing sometimes that medication has to be delivered with a needle. And so what's funny enough is I ended up getting diagnosed with gestational diabetes, and so
Oh,
now I've had to prick my finger. And so it's a great example too of just how repeated sort of exposure to this thing that's not scary, that's not that
mhm,
painful, just causes you to recognize that, oh, that was just, an unwarranted fear that wasn't based in any sort of reality. And so I've gotten super
mhm.
used to now pricking
Yeah.
myself. And so now it's like no big deal.
Oh, that's
Check my
awesome.
blood sugar. So,
I'm sorry about the gestational diabetes, though. I didn't know.
oh, it's fine. It's fully managed, which is the great news. But it was just an interesting thing about, like, of course this would happen to me being needle
Of
phobic. Of course
course.
I would end up having to prick my finger multiple times a day to check my blood sugar.
And of course that you're an expert on anxiety and safety aids, and that one you happen to avoid needles, and then life gave you an opportunity
Yes.
to say, "Hey, show up. Show
Yep.
up for this."
Got to
And
show
what
up for this. It's not just for you.
Yeah, but what happened, that's a really good point. And that, I think that's the whole point about safety aids. They do manage discomfort. They are helpful. Um, they do, we all do them. We do them all the time. However, it's noticing when it's getting you in trouble. Like, for example, in this situation, if you hadn't been able to check your blood sugar,
Yeah.
uh,
It
you
could have been
might not be able
problematic,
to.
right? Yeah,
Yeah, yeah. So it was really important for you to work through that needle phobia.
absolutely.
And so that was my next question. How do you know when you're engaging in these safety aids and they're okay versus maybe a problem for you? How do you know the difference?
That's a great question. And I oftentimes, have to explain that to patients because we have, a couple of different list of safety aids. There's safety aid frequency sort of questionnaires that we can give, in treatment, or, that you can go online and find. And sometimes, you might read a behavior and say, well, I do that. Is that a safety aid? And so I always tell patients, one of the first things is if you're unsure if it's a safety aid, like one that you're using for anxiety, try not doing it and see what happens. Um, because if you get anxious when you don't do it, it's an anxiety related safety aid.
Okay.
So I always say, let's just do a behavioral experiment if you're unsure. So just try
Okay.
not, when you get that natural urge to do X, Y, or Z, try not to do it. And if it's not really that hard for you, if you're like, oh, that wasn't so bad, it's probably not an anxiety related safety aid.
Okay.
But if you get anxious, if it makes you uncomfortable, then it might be a safety aid. And so that's one of the first steps, is just understanding what you're doing when you're anxious to know whether or not it's something you need to work on.
Okay.
Um, but then there's also, how much time do you spend doing it? How fearing or impairing is it in your life?
Okay.
And I always give a good example of this with patients about things like locking doors, right? So we all, live in a society where, and especially I live in New Orleans, where crime, is
Yeah.
around, and so we want to be safe. And so, at night before I go to bed, I have a little nightly routine of sort of washing my face, brushing my teeth, going to, check the front door, letting my dog out, that sort of stuff. And so, that locking my door once before I go to bed at night isn't inherently necessarily a bad safety aid. It's actually preventing a real, true potential outcome from occurring, which is someone
Mm-hmm.
just walking into my home.
Mm-hmm.
Um, but if I'm getting up 2 and 3 times throughout the night to
Mm-hmm.
go check that door lock to make sure and ensure that I've locked it,
Mm-hmm.
then that's starting to be somewhat impairing potentially, right? I'm getting disturbed sleep. I might be waking my partner up, by sort of rustling around and getting up and checking these things. And so I oftentimes tell patients too, it's not just the behavior, but it's how the behavior starts to impact your life, either in the amount of time it's taking or how it's sort of causing you to, be impaired in other domains. Um, and so that can oftentimes be a good telltale sign of like when it's gone too far or when a behavior has went from a true safety aid to a
Yeah.
false sort of safety aid.
While you were talking, I was just thinking of so many examples from the mental health side to the physical health side. I have a child with diabetes,
Yeah.
and he can have episodes where he has quite a few low blood sugars, and I'm checking his um, um,
Yeah.
Dexcom
Yes.
often. Other times I don't check it at all. It's only when I need to. Um, but but when you think about people who've had a traumatic experience, PTSD, their checking behavior, their need to feel safe, their hypervigilance, they might be checking, especially in certain contexts, quite a bit, making sure they're safe. Somebody who's got a chronic health condition like a diabetic or somebody with a heart condition, they might be checking their physical health quite frequently, especially in certain contexts. And so,
Absolutely.
and then
And
you
in those
think about,
contexts, we wouldn't consider it necessarily a maladaptive or a problematic behavior. But I do warn patients that even behaviors that at first are adaptive can become, you know, maladaptive. So like
yeah,
I actually do give the example. I'm so glad you said that, Tracy, with my patients too who are diabetic, because one of the more common safety aids is like scanning your body for certain signs or
hmm
symptoms, or
hmm
things like just checking, your sugars. And so like, my doctor was like, okay, I want you to check it, 4 times a day, first thing in the morning after fasting, and then 2 hours after those main meals. And it's one of those things where that's a slippery slope. If I'm anxious about that behavior, it could become me checking it way more frequently than I need to.
hmm
And it's those
hmm
extra times that are not for a true safety purpose or function
right.
that are the problematic behaviors. But yeah, I think you're right. Some of these behaviors are normative adaptive, and then sometimes they can kind of go awry.
Yeah. And so the way to know whether they've gone awry is the amount of time. And if you don't do it, what happens? Just,
Yeah. And then the impairment, I would say the impairment being the other piece. So is it impacting your ability to sort of engage or do other things like
okay.
sleep or leave your home on time, or
Yeah.
getting in the way in some sort of, I think about like just all out avoidance behaviors, how those could be problematic for your job or your social life if you were, you know,
Yeah.
missing things because of, fears of public speaking, or, of sort of socializing. You might miss out on life events or
Yeah.
important gatherings. So yeah, the impairment piece too.
Yeah. I mean, and I'm just gonna hit on that one just for a second. So the socializing piece, we know there are quite a few people who have social anxiety.
Oh yes.
And or feel discomfort when they're around other people or people that they don't know, and do also either avoid those settings or engage in some sort of substance in order to
Mhm.
feel comfortable. So I just wanted to call that back to your attention. When do you know that's problematic?
Yeah, I mean, I would say when, thinking about like social anxiety, it's somewhat normative for us all to have fears in certain social settings, or to worry, do I look okay or do I sound okay? But for folks with exactly for folks, who have, extreme, sort of social anxiety, they might be avoiding, social gatherings at all costs, which is then impacting their ability to have friends or maintain friendships. Or thinking about folks, because we oftentimes see a lot of comorbid substance use with social anxiety, particularly in college and younger samples, because that's sort of the norm at those events. It could mean that you're engaging, in some problematic or unhealthy substance use as well, that's causing a whole other issue. Um,
Right.
and so, yeah, those types of behaviors can be safety aids as well. And we really see safety aids being common across all the anxiety and related disorders that share that sort of underlying fear sort of component.
Hmm.
um, and what's interesting is that they can look similar across different disorders, like the avoidance piece can look similar, or the distraction or the thought suppression, but why you might be doing it, might sort of differ depending on what your underlying fear is. So is that fear
Yeah.
about negative evaluation, or is that fear about, oh, I'm going to encounter a trauma related cue? um, and so, yeah, so the social anxiety is one of the more common, obviously, anxiety disorders, and so we see a ton of safety aids in that one.
Absolutely. And so the big thing here, we'll move into what do we do about it?
Yes.
The reason why we're talking about safety aids at all is because they are helpful in the moment, but they actually increase anxiety. And so for anybody who's anxious, that's not a comfortable feeling. For any of us who have experienced anxiety, which is all of us, it's not a comfortable feeling. But for somebody with an anxiety disorder, you really want to think about the fact that you might be engaging in certain behaviors to make you feel safe that are actually increasing your discomfort. So, because of that, it's really important to pay attention to them and get help. So, let's talk about what help is available.
Oh, yeah, my favorite part. As a clinical psychologist, obviously, I love the help part. So yeah, so what I oftentimes tell people to do, I think about, anytime you're trying to change a behavior, the first step is just to recognize the behavior. So I
Hmm.
always start with patients with just by, having them, start identifying what are the little things that you do when you're anxious that make you feel better, in the short term. So first, just identify those. And then the idea is that you want to start to sort of what we call fade them out or eliminate them. But I like fade because telling like a child, for example, that you're going to take away their pacifier or their favorite stuffed animal can be anxiety provoking. It's that flooding
Hmm.
experience that most patients don't like in therapy, and why we sort of, you know, went to more graduated exposures and stuff. And so
Yeah.
essentially what you want to do is just slowly start to remove these things from your life.
Yeah.
And I oftentimes give an example when I'm working with patients, of like cigarette smoking. So it's like, if you want to quit smoking, right, you could say, okay, let me track how many cigarettes I'm smoking a day. That would be the
Hmm.
first step to sort of understanding the pattern of your behavior. When am I smoking? And how much am I smoking? And then
Hmm.
the next step would be to say, like, okay, how can I go about slowly starting to fade this behavior? And so that might be, picking a time of the day that you find that you don't really need the cigarette quite as much. Maybe it's not the first one, maybe it's the one, that you're having mid-morning. And you're like, yeah, I'm just doing it usually because I need a break from my desk, but I'm not really having a strong craving. And so that might be the one you want to sort of eliminate. But then the idea is essentially just to start with the small, easy, manageable, tolerable steps and just sort of remove those behaviors.
Yeah.
And thinking about things like, like a patient with social anxiety or someone who's experiencing anxiety, it could be as simple as delaying that first drink until you get to the party, right?
Hmm.
So, you might oftentimes find that you need to have one before you even leave the house to get in that Uber, but maybe you decide, okay, I'm going to wait till I get there to have that first drink, or I'm going
Hmm.
to switch to a lower alcohol content drink.
Hmm.
So maybe I'm going to, instead of having that first drink, be a liquor drink, I'm going to switch to a beer or something.
Yeah.
And just anything that you can do like that to start sort of confronting, facing, tolerating a little bit of that anxiety is like the first sort of step.
Okay.
And that's hard. And so that's why we oftentimes talk with patients about starting small, because
Yeah.
when we make behavior change, we always want it to be like so drastic, like I want to lose weight, I want to lose 20 pounds this week, and it's like,
Yeah.
okay, that's not realistic. So how can we start making easy, sort of manageable, changes in our routine that would allow us to sort of experience some of that anxiety, but in a manageable way? And then that really builds momentum, just like with anything else, where you start to notice, wow, okay, I did that,
Yeah.
now what next?
Yeah. And then the what next, part of the what next is part of the step you were just talking about too, are just changing some of your thoughts. So a lot of people think, if I don't have a drink before I go, this is just an example, or if I have to prick my finger with a needle,
Yep.
I'm going to feel so uncomfortable, I won't be able to survive it, or I'll go insane, or
Yeah.
I just won't be able to handle it. I'll have a panic attack. We often have these really extreme thoughts about how we're not going to survive something or it will be completely unmanageable. And this is just a little bit too extra. That, what we're saying to ourselves is just a little bit too extreme than what is actually true. But we don't know that because we don't test it. We
That's
kind of,
exactly right.
right,
Yeah.
okay. So part
Yeah.
of the change is, find those places where you can really reduce your reliance on the safety aids. And then the other part is, so pay attention to what you're saying to yourself and then just ask yourself, is that even true? Whatever that happens to be, is whatever I'm telling myself about why I need to do whatever I need to do, is it even true?
That's yes, that's you're hitting it spot on. But yeah, one of the things that's so neat about, sort of working with safety aids is that it is more of a behavioral sort of step and approach to sort of treating anxiety. But
Hmm.
there is such, from a CBT perspective, that cognitive component, right? And the narrative, the storytelling that's happening in our minds.
Yeah.
And so being able to sort of, challenge that fear and recognize that, okay, just because I think it doesn't make it true,
Hmm.
can also be helpful then for sort of continuing on and continuing to work on, sort of moving, that needle, as we might say,
Yeah.
along that continuum, and kind of continuing to decrease those behaviors. But yeah, a lot of
Yeah.
times we tell ourselves things like, this is going to be horrific, or I'm not going to be able to tolerate my anxiety. And that's
Yeah.
just not true.
It's just not true. Yeah. So give
Yeah.
yourself a moment to test it out.
Yes.
Give.
And I always tell patients too, like, reflect on what went well. Like,
Hmm.
when I'm asking them, if I'm working with a patient on safety aid fading, they'll want to tell me what went wrong, and they're missing the whole point of, like, even if you resisted the urge for a minute or 2 minutes to not go check that door lock,
Hmm.
or you waited an additional 5 minutes to have that first drink, that's a win. That's
Hmm.
still 5 minutes longer than you went before. And in that 5 minutes, did anything happen? And that's the other thing
Right.
you really want them reflecting on, is that what is it that you fear is going to happen when you don't immediately do this thing, and did that thing occur? And because
Yeah.
it's a false safety aid, the feared outcome never occurs, because it's not actually preventing the real outcome from occurring.
Right. And maybe over time that anxiety starts to lessen because you're not relying so much on the safety aids.
Exactly. That's exactly what happens. Yeah. So the more you learn that this thing isn't preventing the feared outcome from occurring, that you can tolerate your anxiety, essentially that fear structure in your brain, that anxiety just starts to sort of dissipate, whittle away. And
Yeah.
next thing you know, you're not so reliant upon this behavior anymore.
Yeah. Do you have a favorite? This is maybe I might be putting you on the spot and you can say, nope, I'm not answering that. But do you have a favorite patient you worked with who relied on safety aids that just would be a good example to tell us about and they worked through it?
I have a really funny one I can tell you about.
Oh, I like funny.
Yeah. So I was working with a veteran at the VA who, had PTSD, had a lot of concerns related to safety based on a prior trauma. And we were working on door checking, particularly at night. There was a lot of,
Okay.
checking doors and locks, not in the same reason like OCD folks may check on it because, they feel, like responsible for harm, or, maybe that they didn't do it just right, or a certain number of times. But it was really the behavior was related to their fears about their own safety.
Hmm.
And so, they'd wake up in the night and they'd have these intrusive thoughts about, what if I didn't lock it? And what if someone's going to break in? And so they'd go and check it. And so we had decided, first we wanted to just sort of monitor the behavior. So I had them sort of keep a tally that week of how many times they got up each time throughout the night to sort of check the door. So we'd have an idea of the frequency of the behavior. And then the idea was basically to have them sort of, fade that out. So if you're checking it 6 times throughout the night, let's try 5 each time this week. Let's just
Hmm.
try, resisting that urge 1 time throughout the night. And
Hmm.
is there a time that's maybe a little bit more comfortable? Is it maybe the first time you wake up because you have a better memory of when you went to bed, an hour ago, and so that you locked it?
Hmm.
Or is it that last one that you do right before you wake up in the morning, and you're going to start your day, and you can think, well, I can hold off for another 30 minutes and get up, when my alarm goes off. So we were working on that behavior, and they came in the next week and they were so proud of themselves. They were like, I didn't check it a single time.
Wow.
this week. And I was like, oh my gosh, that's amazing. Like, tell us, please. It was a group treatment. Like, tell us what you did. How did you resist that urge? Like, what strategies did you use, and what worked for you? And without skipping a beat, he goes, I put a whole bunch of cans with pennies right in front of the door. And I was like, oh gosh, I have failed you. We have
I
just
have failed
replaced
you.
one safety aid with another. So he was comfortable in the fact that he knew that he had put enough cans out that
Hmm.
if the door were to open, he would have heard the sound. And I was like, okay. I was like, great job not checking the door. This is a great example of how sometimes our anxiety will, basically cause us to do something else. It's like it was still so much there. And so
Yeah.
it was a good, like, funny moment for folks in the group and for him too to recognize that all we had done was replace one bad behavior with another behavior. And so we were like, okay, so now we're going to have to reduce the number of cans this week that are in front of the door. But it was just such a good teaching moment for me too, to not forget to fully explain the purpose of how safety aids work and how it
Right.
can be, sort of counterproductive if we're just going to take
Mhm.
away one and replace it with another.
Right.
But yeah, it's a good example of how he'd really done the homework.
Mhm.
That we had sort of taken one step forward and then of course a giant step back.
Yeah.
Um,
Yeah, because the whole point of these is, I mean, the reason why it's important to really reflect on whether or not you're engaging in these and consider why maybe you shouldn't be, or how you can reduce the use of them is because they don't manage your anxiety. You're using them because you think they will, but they're in fact increasing your anxiety. And none of us want you to feel that anxiety or be ruled by your anxiety. The goal is to get those anxious feelings reduce. And safety aids don't help with that. They actually increase anxiety. So yeah, the cans and the pennies, it's a great idea.
yes, I was like, how helpful. And that's the other
Right.
thing, that I try to remind patients of, is that not all of these behaviors are bad
Right.
necessarily, depending on how the function of the behavior. And so, like, as humans, we engage in a ton of safety practices,
Hmm.
seatbelts, wearing condoms during sexual intercourse, maybe with someone, that we're unfamiliar with, or, even things like sunscreen, right? It's there to protect us, but it's just that these things can, can also become not actually helpful in the sense that
Helpful.
they're not serving a true safety function. So this is a good example. It's like you have a lock on your door and you probably have, an alarm system. Those are the real safety aids.
Yeah.
But, the extra things that we're doing aren't really helping us.
All right. So if somebody is listening and they recognize that either themselves or somebody that they love is engaging in these behaviors and they're not helping them,
Mhm.
and they want to get help, where should they go for help?
That's a great question. I mean, I would say if it's, to the point where the behaviors are super interfering and they feel like they may have an anxiety disorder, I would always recommend, seeking out a therapist.
Mhm.
There are, Psychology Today, the Association for Behavioral and Cognitive Therapies, lots of places where they can go. I think your website even has some help materials on it. And so finding someone who can work with you, and, most of what I do in treatment with patients when I'm working on safety aids is no different than what's happening in CBT. I'm just sort of approaching it in a little bit of a different manner.
Yeah.
And so, yeah, working with someone who can help them, but also if it's, something they feel like that they could work on, on their own, you
Hmm.
know, these things, are pretty, easy to work on, in the sense that, if you feel like you can handle it, it's just about monitoring those behaviors and then slowly starting to approach them. And I,
Yeah.
I oftentimes think about it like kind of what you said earlier. I give examples of like what you would do if your child fell off a bike, or, your niece fell off a bike and you were trying to get them to ride it again. You might slowly introduce them to the bike, and sort of get their feet wet with it, and, put the training wheels on and then take those off. And so you're just slowly approaching this thing that seems scary when it's not. And
Yeah.
so in many ways we can work on some of these on our own.
Yeah.
But sometimes it's also helpful to have that coach. I think about it like working out. It's like, yeah, I could do it on my own, but sometimes having the trainer
Yeah.
holds me accountable and makes me, really sort of prioritize this every week in a way that I may not otherwise.
Yeah. That's awesome. Awesome. Thank you for being here today. I feel like that note was just a great place to end our session today. Any final words?
No, I'll say that I am if there are any therapists listening, I along with my graduate student mentor, because that's where a lot of my interest in this area sort of came from, and then of course his mentor. So that's Mike Telch at University of Texas Austin, and then Brad Schmidt, who was my mentor at Florida State University, is where all of my interest in this area came from. And we actually, Brad and I, along with some others, published a treatment manual that is freely available for clinicians within and outside of the VA, called START, Safety Aid Reduction Treatment. You can Google it, find a link to it. And so we're going to work on, also in the future, making a self-help version of that could be helpful for patients who maybe want to work on it on their own. And so, yeah, it's a great resource for clinicians or others who might just want to know a little bit more about safety aids and sort of have some understanding of how they might, be able to start to work on these behaviors on their own.
That's wonderful. Thank you so much for being here today.
Thanks for having me.
Thank you for joining us on Choosing Help. And if anybody, if you yourself or somebody you love is struggling, please feel free to look up our resources at our website, choosinghelp.com. My guest today was Dr. Amanda Rains. Feel free to look up information on her and her manual. And thank you for joining us today.
Thank you for having me.